Hi everyone, this time I'm talking to Elise Lennox about the work she has done with spinal cord injury. Elise, welcome.
Thank you, Jeff.
So let's begin with the whole idea of spinal cord injury and how Behaviour Works Australia was involved in this project.
So a spinal cord injury is a really catastrophic, unexpected and life-changing injury that impacts on all elements of a person's life as well as the lives of those around them. So in Victoria, each year around 100 people will sustain a spinal cord injury, and around 35% of those are young men under the age of 35. And despite being overrepresented, the health system really struggles to engage these young men in decisions about their health and lifestyle.
So why is it important to reach out to young men under the age of 35 in this particular cohort?
So despite being overrepresented in the presentation of spinal cord injuries, healthcare systems really find it difficult to engage this cohort of people living with spinal cord injury. So young men face, really unique challenges in seeking help, and often that's tied up in things like masculinity and self-identity and stigma. And so healthcare practitioners and social support systems really need to think differently about how to engage these young men in decisions about their health and lifestyle moving forward.
So tell us about the project itself and Behaviour Work Australia's involvement in that research and what you discovered along the way.
So we really wanted to inject new thinking into how to engage young men living with spinal cord injury, and we really wanted to consider the life journey and think about the re-establishment of daily routines, think about the decisions people need to make around work or education and things looking differently than they might have expected. And so what we did was we partnered with Austin Health and AQA, and one of the key things that they do is providing peer support for people living with spinal cord injury. And this project was also funded by the Victorian Transport Accident Commissions, the TAC. And they really took a leap of faith with this project in really allowing us to take a step back and explore the problem really broadly and think about considering that life journey and injecting new ways of thinking into this issue, and thinking about how we could adapt current practices, implement new interventions, and also think about how we can shift from the traditional medical model of care towards a more social model of care.
So how do you start with a project like that? You're trying to reach out to this particular cohort that is often resistant to making that sort of contact. How do you begin?
So we started really broadly with this project and actually looked to other sectors. So looked completely outside of spinal cord injury to other sectors who were also engaging young men and thinking about how they did it. So we started with a literature and practice review, looking at the barriers and facilitators to engaging young men in general. Then we conducted a stakeholder dialogue with people working with young men in other sectors to really understand how they thought about engagement. And that's when we sort of funneled in and then tried to see how we could translate those learnings into the spinal cord injury space.
So in terms of interventions, what did you come up with and how did you come up with those particular interventions?
So once we moved into the spinal cord injury space, we conducted interviews with young men living with spinal cord injury and those who support them to really understand the drivers and barriers of engagement. And one of the key things that we found was that there was a lack of people living with spinal cord injury working in the hospital and the rehabilitation settings. And another key finding was that young men often struggled to relate to able-bodied professionals who were trying to model skills or provide support.
Right. What was the intervention? How do you overcome those barriers?
So what we did was we actually paired allied health clinicians, so in this case physios and occupational therapists, with peer coaches. So they were people with at least 5 years of lived experience. They were already working as peer support workers with either Austin Health or AQA. And they had undertaken train the trainer programs that were sort of at that elevated level of providing peer support. And so we paired them up to co-facilitate the allied health therapy sessions of newly injured young men.
Were there any pre-existing relationships that you could draw on?
Yeah, absolutely. So the Victorian Spinal Cord Service within Austin Health had an existing partnership with AQA to enable peer support workers to contribute to various components of a patient's rehabilitation experience. And we had anecdotal evidence that this was beneficial, but it was really reliant on personal relationships between select clinicians and available peers. So we really wanted to shift this beyond those personal relationships and increase the availability of peer support to the broader allied health team in order to formally evaluate this approach.
So the intervention was about identifying a gap, so to speak, realising that there were successful relationships in a pretty ad hoc fashion, and trying to actually formalise those relationships and scale it up in a way.
Absolutely.
So tell us about the behavioural reflection tool.
Yeah, so basically that was designed to be really short. You know, we know these health professionals are time poor, but we wanted to have something that really prompted the allied health clinician and the peer coach to reflect on the sessions that they'd had and think about what they could do differently next time. So really trying to strengthen that partnership at the same time. So we asked questions like, what went well during the session, what they think they gained by working together, what's something that they could do differently next time. And then we actually asked them to set an implementation intention and list something that they intended to do differently next time. And then in subsequent tools, we asked whether they had tried what they had intended to try and how that went.
What's the behavioural science behind a written intention to do something? Why does that work?
So when we write something down and really sort of commit to doing that in our minds, we're more likely to follow through with that behaviour.
Great. So what was the feedback from this intervention?
Yeah, so this approach was really well received by all types of participants, so allied health clinicians, peer coaches and newly injured young men. So we had 5 allied health clinicians, 3 peer coaches and 3 newly injured young men participate in this intervention. And the allied health clinicians really appreciated the structure that had been given to the previously ad hoc approach. And the peer coaches found the role a lot more rewarding. So their traditional role was, you know, sort of cold going up into people's rooms and trying to start a conversation.
Yeah.
Whereas through this approach, they were able to have conversations about skills in context. So they did things like cooking and dressing, transfers, whereas previously their involvement had been quite limited to wheelchair skills.
Right. And really it is connecting people with lived experience for those suddenly in that world with that lived experience and bringing that a much more kind of equal relationship in a way.
Yeah, and it also really sort of enhanced the real world applicability of these sessions. So the allied health clinicians really acknowledged the limitations of what they were able to provide. So we had someone talk about being able to provide the textbook version, but the peer coaches were able to provide alternative ways of doing things based on the real world experience. And, you know, the allied health clinicians' experience is very limited to the rehab setting. So this helped to broaden their thinking around what things might actually look like out in the community.
So it's not just the healthcare professionals, the actual participants themselves found this a very successful program.
Yeah, absolutely. So one of the participants talked about how they were really sceptical about being involved in the beginning. You know, they didn't want someone else coming into their sessions and seeing what they could or couldn't do. But once they did get over that and were happy to have a peer coach involved in their sessions, they really appreciated it. They learnt things that they wouldn't have thought about otherwise.
So what about the future?
Yeah, so there was a real desire to expand this approach to other disciplines, so things like bedside education with nurses, involving social work, even thinking about how psychology could be involved. And we also acknowledged that this approach could benefit other ages and genders, despite focusing on young men in this instance. So we'd really like to do a larger trial that's open to everyone.
There is also economic benefits to this if it works.
Yeah, potentially. So we're looking to do a larger trial and also include a health economist in that, so conducting an economic evaluation to try and establish what those economic benefits might be in terms of things like independence, whether this helps people return to work earlier, increases engagement or participation in the community, potentially reducing representation to hospital, reducing length of stay, things like that.
Elise Lennox, thank you very much.
Thanks, Jeff.